The good thing is, I mean, we really need an initiative, and exercise as medicine is one of those initiatives, trying to get people more physically active and getting clinicians throughout the healthcare system to promote physical activity because it's desperately needed. It's probably physical inactivity may be the greatest threat to health in our modern society. Now, the good news, though, is that one can get lots of benefits from levels of exercise that are well below the federal guidelines. I mean, the federal guidelines have been saying for years, all individuals need to do 150 minutes per week of moderate physical activity or 75 minutes per week of vigorous physical activity. Now, and some people obviously are doing way more than that, but the majority of people are doing well less than that. The Institute of Medicine is saying that some physical activity, which would include walking to your car and doing what I had to just do to get to this part of the building in the McCormick Center, all counts as physical activity, but it should all add up to about 60 minutes per day of total amount of physical activity. The fact is, people are well below this on average, probably less than 20% in our society are meeting these guidelines. So there's no question that people in their busy lives have trouble finding time for exercise. And our data at least suggests that you can get benefits. Maybe you would get more benefits, with a little bit more, but you can get pretty substantial benefits by just pretty small investments in time. Absolutely. I mean, the ideal would be to start exercising as a kid and do it throughout your lifespan. And it probably, and most of the data that I've been dealing with has been in adults. So I haven't been really working with kids, but there's no question that physical activity in kids is just a major problem. I'm 56 years old now, but when I was a kid, everyone was outside playing all day, every day. Well, that's not the case at all anymore. The kids are inside watching TV, playing video games, playing on the computer, and not getting physical activity. The physical activity problem is probably getting worse, and we've published a couple of papers showing that over the last 5 decades, there's been dramatic declines in the total amount of physical activity. Now, part of that is the industrialization of our society, which has been a good thing. But from the standpoint of physical activity, it's produced dramatic declines. And so a lot of people will debate what's the cause of the obesity epidemic. They blame it all on fast foods and the sugary beverages and McDonald's and Burger King and Taco Bell. Well, sure, if you're going to be very physically inactive, you're going to have to cut all your calories from everywhere to make up for that. But the problem is not the calories. The problem is the dramatic decline in physical activity. If we were doing the physical activity that people were doing 5 decades ago, you could eat a lot more without getting into trouble with weight. So we really do have to make it a very high priority, starting young, but also recognizing that it's never too late. Now, the older you get, if you start down to about 80-year-olds, a lot of time, if they've been very inactive for a long period of time, you have to start very slow. And sometimes in very older individuals, even doing things like strength training, balance training, prevention of falls, is maybe even more important than the aerobic exercise. So a lot of times resistance exercise, weight training, can help the very elderly, particularly the frail elderly, even more so than the aerobic exercise. But yes, it's never too late, but the ideal would be to start as early as possible too. I mean, the question is, should some things be mandated? And it's hard to do that in our society. It's hard to make rules. I'm not necessarily for, for example, in New York, they were putting taxes on sugary beverages, or making laws that you couldn't have a sugary beverage above a certain ounce size. And I think that's getting pretty restrictive, telling the public what they have to do and what they, I think there should be some freedoms. But on the same token, it may be quite reasonable for, for example, big employee groups to raise the premiums for their members who smoke. or who show, who can't prove that they're not smoking with maybe urine tests, or ask people to wear a pedometer, and if they wear a pedometer and they show that they do so many steps, if they're getting 10,000 steps per day and they meeting the guidelines for steps, that they can get reductions in their premiums. Those kind of things may provide incentive. And anything that can be done that increase the physical activity, I think would be a positive way. Again, there's no way you can make a law saying somebody has to do it, but if you gave people the incentive to do it. Now, in a perfect world, the incentive would be to feel better and have better health. But I think sometimes the way you get people to do stuff is through the pocketbook.